Hey everyone, so last time I made an update, it was about 3 weeks after my top surgery. So now I'm at 9 months post-op, keyhole. Um, so a lot has changed. Over the first couple days, I had some drains and lots of pain, kind of like pressure, lots of bruising. I didn't expect all that bruising actually, and it was within the first, I'd say, month before it finally went away, and the stitches were dissolvable, and they took, say, maybe a good month, a little bit more to dissolve. I thought that was pretty weird at first, but then after reaching out to my surgeon, he said, nope, they should dissolve. It takes a little while. They weren't really noticeable anyways, because I had very little stitching just at the bottom of the areola. So as far as that went, the aesthetics were pretty good during the healing. I was supposed to wear my post-op binder, which was, I had like a full length one. It had little like clasps to do up all along the bottom. I wore it on there were like two options, like the tightness. It's like the first clasp and the second. And I always put it on the second clasp up at the top from about here down, and then it was like looser at the bottom because I didn't really need to do anything with binding here. So actually, after my surgery, or right before my surgery, I was told I had to get a post-op binder, and it was probably my fault from not researching or anything, but I had no idea I'd have to be wearing a binder after. And my surgery was in the summer, so it was really hot. And also it was like in Manitoba, and it's pretty hot there. It's the middle of Canada, so, and it was July. But yeah, so I tried to get around wearing my binder as much as possible, even though I was told you have to wear it 24/7. I'd take it off just at least once a day, just to kind of like breathe and to check out the healing. And then as the healing improved, I started taking it off just to wash it, but I would leave it off for like an extra hour. Yeah, so maybe not the best, but I noticed that the the right side, yeah, had a little bit more swelling, and so I had emailed my surgeon, I'd say a couple months after, because the swelling didn't go down and it was just a little bit more like fluid on this side. So, and he was like, oh, could be a hematoma, could be just like buildup of fluid. So to give it a little bit and it should reabsorb. So it actually hasn't reabsorbed yet. It wasn't as bad, and now since I've been able to work out my chest, it's more noticeable. But it still doesn't. You can't really notice too much. Yeah. The only other thing I've noticed as far as like healing goes is, oh yeah, so it probably would have been wise to wear my binder the full time. Maybe it's due to that. I did take it off like 2 days earlier than I was supposed to. I was supposed to take it off after 4 weeks. I've heard other surgeons do 6 weeks. But yeah, at the 4 week mark, I took it off a couple days before. Figured it was close enough. But, and then I swam, actually, pretty soon after too. I was told I could swim after the 4 weeks, so I did swim. And I did go out in the sun without my shirt on, and I was told that that's not good for the scarring, but I didn't really have any marks that could scar too much. Nothing happened. Yeah, so one thing I didn't expect is with Keyhole, they're supposed to keep the sensation mostly. Well, I lost some sensation, mostly here. It just kind of feels like when you go to the dentist and you get your mouth frozen, and then you kind of can poke it and you can feel the poking, but you can't really feel it. It just, you can feel the skin moving, kind of the same thing. But I'm not too bummed out on that. I don't really care about the sensation anyways. It was more for the looks. Okay, I'll show you how it looks. I'll take this. So, it looks pretty good, pretty even. The nipples, though, one thing that I noticed was that he wasn't intending on doing any revising of them or anything, but I did ask him to uh, size them down a little bit. So he said he would take a little bit off, and I was okay. But the way that it is trimmed, I guess, is this one looks much more realistic. It actually responds to the cold and stuff like that. And it looks pretty similar to Assist Guys. This one, however, doesn't as much. I don't know what happened. Maybe I did have my nipple pierced before here, so could have interacted with that. But it actually, the whole thing kind of responds to the cold. It all gets like erect. So, yeah. I mean, it doesn't look abnormal or anything. It's just kind of a little quirk that I've noticed. Yeah. As far as the side goes, so it does come out a little bit. Could be because I do have some muscle there, but also there is quite a bit still left, as you can see if I pinch, flex and pinch, and you can see that it's still there a little bit. It does round around pretty well, so it's fine. And this side here is the side that had the swelling. So you can see it right along here. Let's see. Does have quite a bit. And when I do this, it kind of droops a little bit more. But it's, like I said, it's not too noticeable. So yeah, and then the numbness is right around here. It kind of varies, but yeah, I'd say like right here. Doesn't bother me. So, and oh yeah, the incisions. Can't see, but they're right here and here. So you wouldn't even know, really. And I don't think I'm gonna go back for any revision. This bugs me a little bit, but it's not enough for me to do anything about it. So I just put up with it. So that's pretty much the healing so far. I don't expect much else to change. There's no scarring to really fade or anything like that. So everything's been good. And yeah. So that was my update, and expect more soon. Bye.